Dr. Hazem Al-Mandeel, a leading expert in urogynecology and reconstructive pelvic service. Royal Hyatt Hospital is very honored to have you speak at the International Conference on Updates in Women Health. My name is Safa Al-Masri, quality manager here, and on behalf of Dr. Abu Bakr Al-Mardi and the entire committee, thank you very much for the incredible session that you had presented. It was very insightful. Thank you.
Thank you very much. Thank you.
My
I just want to say that, if I may add, I'm actually very happy to know that, a nice private hospital is organizing scientific, meetings, because this is really the essence and the importance of improving the quality in any aspect, not only governmental, but should be also more on the private side. Thank you for inviting me.
Thank you, Doctor. The first question, many people have heard concerns and read reports about the long-term safety of surgical mesh or sling used to treat incontinence. For the average woman considering this procedure today, what is the one key question that she should be asking her doctor right now regarding the long-term risk and material safety that goes beyond the informed consent?
Okay, thank you. This is a very important point. And as I mentioned in the lecture before, that the concerns came up, in the past few years with the presence of synthetic material. We call it foreign body in the vagina, and actually led to some issues that this have been kind of, brought into the use of mid-urethral sling, which is the use of mesh in the vagina. Honestly speaking, like this mesh, the nice thing about it have been there for many years. So since almost now we are approaching 30 years since it was introduced in the market. So it's not something new. Maybe to some extent it was abused in the past. Specifically, it was actually done by those who have not been trained well. So to answer the question, what women need to know about this kind of procedure, specifically the use of mid-urethral sling or mesh in the vagina. Number one, to make sure that this doctor is actually someone who been trained in doing that mesh very well. This person, he or she had a long experience of using that type of device or procedure, with a good success rate. And for sure, it's her right to know all the risk that associated with the mesh. They are all, I would call them, very minor, and to some extent can be managed if it happened, which is in less than 3% of the cases, can be managed easily. But it's her right to understand how that mesh, going to be done, used, how the follow-up will be done, and so on. So we don't want to, make women feel discouraged, because I think in some countries, women being discouraged from doing that procedure, even though it's very effective and very safe, just because of those different warnings, rather than, knowing their situation, how that problem is going to be solved, and so on. I would say maybe the alternatives are there, but to my humble experience and understanding of all the procedures, none of them is simple enough like the mid-urethral sling, and would call it risk-free completely, rather than might be the same risk, if not more. So I would say that this is a good, safe, and effective procedure, as long as it's explained well to that person and done by the proper physician.
Definitely the right people,
This is
professional.
the
That
key,
is
the
the
key word.
word.
Exactly.
So the second question, in the growing area of cosmetic surgeries for women's private parts, there is often a blur between aesthetic desire and what is medical need. How can patients effectively tell the difference between a procedure that has a strong medical need and one that is mostly marketing hype? What the role should be having the government or the medical agencies they have to play to protect women from getting expensive, risky surgeries that they may not truly need and that might not be even working.
Okay, this is actually another very important point, because cosmetic gynecology, as you mentioned, dear, it's getting very popular in the field of gynecology. Many women start, searching about it, trying to even look into who's the physicians or hospitals that, having such available service and so on. Definitely, it was maybe to some extent, being, I would call it, misintroduced into the field of medicine, because the purpose was not specifically only for aesthetic point. Yes, aesthetic point plays a role, but because part of it was for functional reasons and to improve the sexual, we call it, satisfaction, and also the self-image for those women. But because it was over, we call it like, over marketed, or being, brought like in a very nice, pictures, let's call it, and way of making it like this is the real beauty, like any other parts of the body. It was abused, it was misused, it was done by those who have not been trained very well. So to answer your question in more specific way, of course, physicians who are going to practice such thing, they have to make sure that they are well trained first, and also to follow what is the local regulations and situation has implemented in that country, so at least they know they are going to be done in the proper way, and also to be very open and honest, discussing their let's call it, their skills, their abilities, what they can improve, and so on. Yes, cosmetic, as I said, or improving the image of the external genitalia, or even the vagina and the female, is important, but this should be always complemented by improving the function, not purely for the aesthetic part of it. Especially, this is still an evolving thing, and maybe what we see now is acceptable and good, maybe in few years might be something unacceptable. And always the main we call it role in medicine, do no harm. So should always avoid getting this woman into a worse situation. Either we give her the better situation, or better not to do anything at all.
Thank you very much, Doctor. It was very insightful. Thank you for having you today. Thank
Thank you
you.
very much.